Thank you, Madam Chair. Wondering if you can share with us the patient experience. A patient who has COVID-19 goes to the hospital. How long is it taking there? What's the treatment? And then what's the hospital bill look like? If you could maybe talk through that.
One thing is that for many patients, it doesn't require a hospitalization. And in areas of the country like New York City, where there are overwhelming numbers of patients, what has been said for the past couple of months is, if you're just mildly ill, stay home. Right. Because you're going to come in, you're going to use up scarce resources. If you don't have it, you might get infected. If you do have it, you might infect someone else. And if you have it, you'll just be told, go home. That may not be the right answer. The right answer may be, if you can't be safely cared for at home because you may infect your grandmother or someone who's got cancer, come into this facility and we'll care for you until you're no longer infectious. And that's something that we need to think going forward. But for someone who comes into the hospital, what we're seeing is very low levels of oxygen in the blood. And that's a big concern. So oxygenation is a major component of care, is probably the most important part of supportive care of someone with COVID. And doctors in intensive care units are figuring out ways to support oxygenation without intubation and use of ventilators. That's a new finding in intensive care and reduces the number of ventilators we thought would be needed.
What is that care if you don't need the ventilator?
There are a variety of ways to position patients or give oxygen through other means that don't require insertion of a breathing tube and may be effective.
Okay.
And then general supportive care for the individual, making sure that they're well cared for. We've seen very severely ill patients in cities that have been hard hit having a very low survival rate, partly because they're so severely ill, partly because systems are somewhat overwhelmed. We're learning more about how to care for patients all the time. There is potentially good news with remdesivir, the antiviral. It appeared to shorten the time to recovery in a well-done study that hasn't yet been released, but the data has been shared. It had
Can you talk a little bit about that? Reduce it by?
From 15 days to 11 days.
Okay.
And it reduced mortality rate by about 30%, although that difference wasn't statistically significant given the size of the sample. So a non-significant trend toward a lower death rate.
Okay. I'm guessing if you are hospitalized, this is going to result in probably thousands of dollars in hospital bills?
Intensive care is extremely expensive.
And do we have any hard numbers associated with what an average stay is going to look like for patients?
No, I'm sorry.
Okay, all right. And part of this, I want to make an editorial comment in that Congressman Lloyd Doggett, Congresswoman Susan Wild, and I have a bill that would call for the opening up of the re-enrollment for the Affordable Care Act right now. When we have 30 million uninsured Americans, and in the state of Illinois, we have 800,000 uninsured Americans. So I actually partially wanted you to go through that. I mean, we know this is going to be very costly. I mean, we know it by the economic recovery bills that we're looking at, but I just think it's critically important. The Trump administration has pushed back on opening re-enrollment. Ours calls for an 8-week period where people can get in, be re-enrolled in the Affordable Care Act. And I just think, and Dr. Frieden, you've been obviously in the Obama administration very involved in the Affordable Care Act, but I think that's important to note. I mean, what you just talked through is it's a long process. Glad that we're seeing some encouraging news out of the treatment in the hospitals. Want to ask you also about behavioral health. If you can talk a little bit about that from a public health perspective, what we're seeing as far as what's happening with behavioral health, what we need to prepare for going forward, and just what we can do as members of the Labor, Health, and Human Services Subcommittee of Appropriations as we look at that. Maybe we'll start with you, Dr. Rivers.
Yes, I think this is an important area. Going back to our previous discussions about the secondary consequences of this pandemic and the support and treatment and continuity of care that people have had, I think behavioral health is one area that is chronically underserved and undersupported, and I think it's very possible that in the context of this pandemic that those disparities will intensify.
I would just outline 4 areas of concern. The first is interruption of needed care, either ongoing care or need for new care in the behavioral health area. Second is substance abuse and chemical dependency and the need for treatment and potential increased need for treatment and care. The acute trauma of grieving and losing family members or family members severely ill, and also the responders, first responders and healthcare workers. I was health commissioner in New York City after 9/11, and we studied the impact of the World Trade Center attacks. And we found that as severe as the respiratory impacts were of people caught in the dust cloud, in terms of the amount of disability, post-traumatic stress disorder, depression and anxiety caused even more disability. So we have to take care of our responders during this time and limit their hours to the extent possible and provide good care and support.
Very good. Thank you to both of you. I yield back.
Congresswoman Herrera-Butler.
Thank you, Madam Chair. You know, on that last part with regard to mental health and the impact this is having not just on our first responders, although they are constantly in our hearts and minds because they're the ones that are